I've been hearing about a lot of kids with allergies symptoms right now. So, environmental allergies, which often can present as stuffy nose, itchy eyes, a lot of sneezing, itchy throat, watery eyes, sometimes runny nose or stuffy nose. Sometimes it's harder for kids to sleep when they have allergies as well because of all of these symptoms and especially that stuffiness. Sometimes kids with allergies will get kind of darker circles under their eyes or this crease on the nose because they're constantly going like this. So it's a little crease on their nose. So those are some of the general, most common problems with seasonal allergies. Though sometimes also it can just cause other illnesses to flare, like it can cause asthma to flare or eczema to flare. And you can sometimes see some body rashes associated with seasonal allergies as well. So things that can help, one is, being unfortunately sometimes inside with air conditioning that is filtering out some of those allergens. That can be a helpful, at least temporary respite. But really, we want your kid to be able to be out and active and not bothered by the allergies. So I remember having allergies as a kid, and I went to summer camp, and I just remember being miserable, and all of the medicines that we had back then made you pretty sleepy, and so they weren't great. I took them, but I was still pretty miserable. But now we have what are called third generation antihistamines, and these are oral medicines that are once a day, tend to not make you sleepy, and can be very effective. Now, I'm just going to go over them briefly. They go by the trade names. One is Claritin, which is loratadine. One is Allegra, and one is Zyrtec, which is cetirizine. So the thing about these is that I have found, I don't know if there's really data to support this, but I have found and I have learned from allergists over time that there are different strengths to these medicines. And Claritin in general, or loratadine, is not super effective. If it works for you, great, but if it doesn't, then that doesn't mean that this class of medicines won't work. I would then try one of the others. So Allegra or generic Allegra would be the next stronger antihistamine, and then finally Zyrtec really tends to be the strongest. Now, I do hear from time to time like, oh, Allegra worked better for me than Zyrtec, or even Claritin worked better for me than these other ones. And again, everybody is a little bit different, and how we're going to metabolize these is a little bit differently. But generally, I recommend going straight to cetirizine because it's the strongest, most effective, but still doesn't have any different side effects. It still is a once-a-day medicine, shouldn't make your kiddos sleepy. If it does seem to make them a little bit sleepy, you can dose it at night instead of in the morning. And so this is often a very, very, very effective way to battle allergies. And it can be done as needed, so you don't have to take it every single day. Or if you know that you're in a bad allergy season, you may want to automatically do it every day. But it can be taken as needed, and it will kick in an hour or so. Another thing is a steroid nasal spray. So this is things like fluticasone, mometasone. Some of the trade names are Flonase or Nasonex. And these are steroid sprays that go in the nostrils. And so younger kids sometimes don't tolerate this as well, so it may be tricky, but these actually can be sometimes more effective than the orals, or sometimes people need both. But this one helps with decreasing the inflammation that is associated with the allergies. And so it doesn't necessarily work immediately. It may take a few days or a week or even a couple of weeks to really see a difference, especially if it was pretty severe to begin with. And so you do need to do this one every day for a period of time when you know you're having bad allergies. You can't just take it as needed here and there. But this is a really good option. And there are some that are a little bit better tolerated in kids. So in particular, Again, this is a brand name, but Flonase Sensimist. It smells a little bit better, and you don't have to aim exactly perfectly in the nostrils as much because it's more of a mist. And so it can work a little bit better, especially in the younger ones who may have a little bit more difficulty. Either you may have difficulty getting them to cooperate, or they may just have difficulty like doing it. Another one is a prescription that is called Montelukast or Singulair. It's a different class of allergy medicine, and it works differently than the antihistamines. And it used to be indicated just for people with asthma. Now it is indicated just for allergies. Not so much first line, but it can be especially helpful in people who do also have asthma because it can help with both. So this is something that can sometimes added on to these other methods or can be used on its own in certain situations, but it is something that you'd want to talk to your physician about, and it needs to be prescribed. Fairly well tolerated. Very rarely it can have some biological, psychiatric side effects and mood changes, so that's something to watch out for. But the majority of patients that I've had it on actually have felt like it has been just life-changing and effective with minimal side effects. So these are the main classes of options that we have for seasonal allergies. Again, just avoidance too. I mean, I've heard of people who just had to move to a different part of the country or world to avoid the severe allergens that they have. There also is, for people with severe allergies, allergy doctors, specialists can do what's called immunotherapy, which is allergy shots that you may have heard of. So this is something that in severe situations, especially if there are other problems exacerbated by those allergies like eczema or asthma that you're having trouble getting under control, immunotherapy might be a good option. But again, at this point, you would be under the care of an allergist probably who would help you to hear the pros and cons and different things that you can try. So hopefully this is helpful. I am not specifically recommending giving you medical advice about any of these. I just wanted you to kind of know the basics of the options that are out there. If you're having any of these kind of annoying allergy symptoms, which I am having, so I think I need to go take some cetirizine right now. Have a great day. If you are looking for a pediatrician or a breastfeeding medicine physician in the Chicagoland area, particularly the western suburbs, you can find me at intouchpediatrics.com. Have a great day. Bye-bye.